All right, this patient in particular came all the way from California to our office here in Utah because she knows of the reputation I have of delivering high quality care at the same visit. I have a lot of people that come from around the world to visit our office because of the ability we have to be able to generate and turn things over very quickly. I do most of the procedures using this Cerec machine live and deliver within a couple of hours. Sometimes when I'm doing a large case where I'm doing multiple teeth or even a whole mouth, I will deliver the next day. First thing we do is we look at their cone beam radiograph. So cone beam radiograph is what's called a CBCT, or a cone beam computed tomography, or CAT scan, that allows us to be able to see three-dimensionally around the patient's skull. So for example, this is the patient that we're going to be working on here. She has a primary concern of having two missing teeth down here. So this radiograph is very helpful for us because we're trying to determine if she's a candidate for implants or if we have to do some other procedure to replace her teeth. So this patient is very concerned because every time she talks, speaks, or smiles, there's a gap in between her two front teeth on the bottom. And so we're trying to figure out how we can replace this. So this cone beam radiograph allows me to take this inspection window, drag it around, and you can see these three planes here, 1, 2, and 3, representing these three windows down here on the bottom, letting us be able to see three-dimensionally around her jaw. So what we can do is we can actually look at the front of her jaw here in this area of concern, and I can look at the bone structure around this patient's teeth. So right here, I can move from the inside of her jaw out to the outside and see everything in between. So that on a traditional radiograph, all we would see is a two-dimensional representation of what the bone looks like here. So height-wise, she probably has enough bone, maybe, but probably not, because you can see this big bony defect here. So she really doesn't have enough bone here to do implants. We can also, though, look from the top of her head downward and look at the bone structure as well. So this is probably even a more important representation of what we're trying to see here. So I can move down through her jaw and look and see at this top spot right here, and there is not enough bone between here and here for us to be able to put implants in there. So about her only option is to do what's called a bridge from here to here. So we're going to be planning on doing a bridge for her. I'll show you some videos or some pictures of our design on the Cerec machine and then the final product, so you can see how nice this turns out for the patient. So on this particular software, the Cerec software, we can choose a set of teeth, choose the materials that we want to do, and then design that in the administration phase, choose all of those parameters, and then move to our acquisition phase, obtain video or live pictures of the preparation that I've done. These are very accurate, down to about 50 microns or 40 microns accurate. So in this particular patient had missing teeth down on the lower front right here. These two teeth were missing down on the bottom, and she did not have enough bone for implants. So we chose to do a bridge, which is perfectly great option, sometimes cheaper for the patient as well. So you can see my digital scan of the patient's prepped teeth for a bridge. Now, this machine is very unique in the sense that I can actually determine the color of the teeth, the color of the materials I'm going to use from the actual scans that I do. So I take a picture of the preparation and the arch that we're working on. I do choose or get a scan of the opposing arch and its teeth there. And then I also get a scan of how the teeth actually fit together in relation to each other. Then we go to the model phase. We make sure we have the margins drawn in, marked where I want the restoration to start and meet the tooth exactly, very accurate. Then I go to a design phase here where I actually can design the restoration live and then make, so this is the restoration here that I designed based upon her bone height and all of the other things that are going on in the quadrant. I can also look and see where her opposing teeth fit and make sure that it's a good fit. Then I go to the manufacture phase. I choose a material that will work well, that will be strong, durable, and also aesthetic, and just look really great in the patient's mouth. So I chose this particular material for this patient. It's called Emax Zircad, and I use this material because it has a fading from light to dark, very realistic looking material, but also very strong across a long span across the arch. I mill that in a machine. We take that milled restoration out, smooth it and prepare it, and then place it in an oven to what's called sinter, which means cook, and it changes the color it needs to change and forms its natural hardness and its final hardness. Then we take it out and do a custom stain on the patient to make it match all the other teeth in their mouth. That is then cemented in the patient's mouth, and the patient leaves happy and chewing and functioning just the way they're supposed to. And as you can see in these different photos that I've included here, we have pictures of the bridge, how it fits together, and how it's custom stained to match her natural teeth next door.